February is National Children's Dental Health Month.
And childhood tooth decay is the most common chronic childhood disease. And joining us to talk about it is Dr. Terri Alani. Thanks so much for joining us here on the News at 5.
Thanks for having me.
And I think it's the perfect day because all these parents have the kids coming back with these Valentines and chocolate and candy and they want to eat it all. And it was just so astonishing to me that tooth decay is actually the #1 chronic disease that children are suffering from.
It actually is, and it's totally preventable. And what our goal is, our dental providers, is to educate your child early so that these problems don't arise.
So when is the earliest or what's the best time to take your child to the doctor?
Believe it or not, before on their first birthday or when their first tooth erupts. Now this might sound crazy, but it gives a chance for the mother or the parent to educate themselves with the dentist and ask any questions they might have and set the pathway for great dental health for their child.
What is it all about with the baby bottle tooth decay? Like you give a baby a bottle and then, I mean, some people probably don't even think about it.
Exactly. So baby bottle tooth decay is very prevalent, can cause tremendous damage to the baby teeth. What it is when you actually place formula, milk, or any type of fruit juices into the bottle for them to go to bed at night. What happens is that sugar in those formulas is causing it decay because it's direct contact with the teeth. So what you want to do is you want to avoid that and place water instead.
And what about when it comes to baby teeth and say a doctor or dentist may say that there's, you know, a cavity there and you need to fill it, but then you might be thinking, okay, I'm just basically telling you my story that it's going to fall out anyway, so I'm not going to put it in.
And that's exactly, no, you want to save the baby teeth, even if it has a cavity, because what the baby tooth does is it maintains the space for the permanent. So if you lose your baby tooth early, what happens is you get crowding because those teeth will come together before the permanent teeth erupt. So that is super important. The other thing is you want to make brushing your teeth fun. Mm-hmm. There are apps out there that can help with toothbrushing. Take your child to the store with you, have them pick out the character of their favorite toothbrush or like the flavor of toothpaste that they like. And you can actually make it a family affair, possibly, but you want to make it fun because you want to build these lifelong habits.
Okay, but how do you get the kids to not eat the toothpaste? Because it tasted so good when I was a kid. I feel like
so you might want to observe, monitor, supervise at first, and just put like a pea size amount of toothpaste on the toothbrush. When they're an infant, you just want to use water. Get an infant toothbrush and just water so they do not swallow it. But if you just put a little bit, so you want to definitely supervise the amount of toothpaste that's placed on their toothbrush.
And is it so important to go in that like a circular motion when brushing little kids' teeth?
Absolutely. You want to brush at a 45-degree angle for 2 minutes in a circular motion. And of course, as they get older, you want to make sure they floss.
Yes, that's another thing. But when you're holding a toddler's mouth, you're just trying to get the poop brush in there.
Exactly.
So circular motions for you.
That's so crazy. Like, I can't imagine how difficult.
Yeah, it's a whole situation, but it gets better.
It gets better, and brushing can be a lifelong habit that can prevent you from having cavities. We always say dentistry is not expensive, neglect is. So we want to educate parents early.
Well, you're a walking billboard for your work. Your teeth are beautiful. Thank you. Take note from her.
Thank you, Dr. Alani.
Thank you.